Hi everyone, I'm Dr. Renomolecologist and pelvic surgeon. Today I want to share with you something simple, powerful, and often overlooked: how your breathing can improve blood flow even to your most intimate areas. Breathing is one of the most fundamental functions of the human body, yet many people underestimate its impact on circulation and overall health. The way we breathe directly affects how efficiently oxygen enters our bloodstream and reaches different tissues, including the penis. Oxygen is essential for cellular energy production, tissue repair, and most importantly for men's sexual health, but proper functioning of blood vessels. Erections are primarily a vascular event. They depend on blood flowing into the penile tissue and staying there long enough to create rigidity without good oxygen delivery. This process is weakened and erection quality can suffer when breathing is shallow, such as chest breathing. During stress or anxiety, the body receives less oxygen. This forces the heart and circulatory system to work harder to deliver what little oxygen is available over time. Constricted breathing can lead to stiffer blood vessels, elevated blood pressure, and diminished circulation to extremities such as the hands, feet, and penis. In contrast, deep and controlled breathing, particularly diaphragmatic breathing, allows the lungs to fully expand, maximizing oxygen exchange. This abundant supply of oxygenated blood flows more easily through the arteries, promoting vascular health and delivering essential nutrients for robust sexual performance. The penis is particularly sensitive to oxygen supply because its erectile tissue relies on healthy endothelial cells that line the blood vessels. These cells produce nitric oxide, a chemical that signals the smooth muscles and penile arteries to relax, increasing blood flow. Insufficient oxygen can reduce nitric oxide production, resulting in weaker erections. Deep breathing helps counter this by ensuring oxygen consistently reaches these tissues, promoting better nitric oxide function and more reliable blood flow when arousal occurs. Additionally, breathing influences circulation through the nervous system. Controlled, deep breathing activates the parasympathetic nervous system, the body's natural rest and relax mode. This reduces stress hormones such as cortisol and adrenaline that tend to constrict blood vessels and redirect blood away from sexual organs by lowering stress and enhancing relaxation. Proper breathing ensures more consistent blood flow to the pelvic area, and this makes arousal more natural and erections easier to maintain. For men over 50, this becomes even more important as natural age-related changes often restrict circulation. Practicing effective breathing is a simple free tool to restore oxygen supply, protect vascular health, and support erectile function. It is a reminder that something as basic as how we breathe can directly influence not just overall well-being, but also sexual vitality. Many men over the age of 50 begin to notice changes in their circulation, and this is often tied to a combination of natural aging, stress, and long-term lifestyle habits. As the body grows older, the blood vessels lose some of their elasticity. Arteries that once expanded easily to carry blood through the body stiffen, making it harder for blood to flow efficiently. This reduction in vascular flexibility has a direct impact on areas that rely heavily on good circulation, including the heart, brain, and the penis. Because erections are essentially a blood flow event, anything that restricts circulation will almost always affect sexual performance. Stress is another powerful factor that compounds the issue. Chronic stress activates the sympathetic nervous system, sometimes called the fight or flight response. This state floods the body with stress hormones like adrenaline and cortisol, which constrict blood vessels and raise blood pressure. While this response can be useful in short bursts for survival, constant activation leads to long-term vascular strain and poor circulation. Many men over 50 deal with stress from work, family responsibilities, or health concerns, and over time this can drain energy and reduce blood flow to areas like the pelvis. Lifestyle habits also play a critical role. Decades of smoking, drinking excessive alcohol, eating processed or high-fat foods, or living a sedentary lifestyle can all damage blood vessels and decrease circulation. Smoking in particular narrows arteries and decreases nitric oxide production, both of which are vital for achieving erections. Similarly, carrying excess weight around the midsection is strongly linked with vascular disease and reduced testosterone levels, both of which impact blood flow and sexual function. When combined with aging, these habits accelerate circulation, decline, and make it more difficult for men to maintain the same level of vitality they once have. On the other hand, men who maintain good habits often experience much less decline. Regular exercise keeps arteries flexible and promotes blood flow, while diets rich in fruits, vegetables, and omega-3 fatty acids protect blood vessel health. Stress management techniques like deep breathing, meditation, or yoga reduce the harmful impact of chronic stress hormones, allowing blood vessels to stay more open and functional. These positive habits don't stop aging, but they can slow down its effects and keep circulation strong well into later life. Ultimately, reduced blood flow after 50 is not just an inevitable part of aging, it's also the cumulative result of how a man has lived. Recognizing this provides an opportunity to take control, reverse some damage, and support better circulation through conscious choices every day. Deep diaphragmatic breathing, often referred to as belly breathing, is one of the simplest yet most powerful techniques for improving both stress management and circulation. Unlike shallow breathing, which primarily uses the chest and leads to rapid, inefficient breath, diaphragmatic breathing engages the large muscle at the base of the lungs, allowing for fuller oxygen exchanges, deeper form of breathing signals, the parasympathetic nervous system, the body's natural rest and digest mode, to activate. As this happens, stress hormones such as cortisol and adrenaline begin to decrease, leading to lower blood pressure, improved heart rate variability, and more relaxed blood vessels throughout the body. When blood vessels relax, circulation improves for men over 50. This is particularly important because age-related vascular stiffness can make it more difficult for blood to flow freely. Erections depend on the ability of arteries in the pelvic region to dilate and fill with blood by reducing stress hormones and promoting vascular relaxation. Deep diaphragmatic breathing can directly enhance this process, supporting better erectile function naturally. It essentially works as a non-invasive drug-free method to prime the body for improved blood flow and oxygen delivery, not only to the penis, but to all organs and tissues. Practicing this technique requires awareness and consistency. To begin, one should sit or lie down in a comfortable position, place one hand on the chest and the other on the belly, and take slow, deep breaths through the nose. The goal is to ensure the belly rises with each inhale and falls with each exhale, while the chest remains relatively still. This practice can be done for just 1 to 5 minutes at a time, yet the benefits accumulate quickly. Studies show that even short sessions of diaphragmatic breathing can reduce blood pressure, calm the nervous system, and improve oxygen saturation in the blood beyond the physical benefits. This type of breathing also has a strong psychological impact. Stress and anxiety often fuel a cycle of poor erections, as worry about performance leads to even more tension in the body. Deep breathing interrupts this loop by calming the mind and fostering a sense of control and relaxation over time. This mental shift can improve confidence, reduce anxiety around sexual activity, and create a more favorable environment for natural erectile function. In essence, deep diaphragmatic breathing is more than just a relaxation tool. It's a way to reset the nervous system, improve circulation, and directly support vascular health for men over 50. Incorporating this practice daily may offer profound improvements in both overall wellness and sexual vitality. A 1-minute focused breathing exercise may sound too simple to make a difference, but research shows that even very short bursts of controlled breathing can create measurable changes in circulation, including to the pelvic region. When you slow down and take intentional breaths, you activate the diaphragm and stimulate the vagus nerve, which plays a major role in regulating heart rate and blood vessel tone. This shift encourages blood vessels to relax and dilate temporarily, increasing blood flow throughout the body. For men over 50, where age-related vascular changes often limit circulation, This brief practice can provide a natural boost to pelvic blood flow and support erectile function without medications. The key lies in the mechanics of how breathing affects the cardiovascular system. With each deep inhale, the diaphragm contracts and moves downward, creating more space in the chest cavity and allowing the lungs to fill fully with oxygen. This negative pressure draws more venous blood back to the heart, effectively improving circulation. On the exhale, when the diaphragm relaxes and moves upward, there is a gentle compression on abdominal and pelvic blood vessels, which helps push oxygen-rich blood outward toward tissues, including those in the lower body. This rhythmic pressure change acts like a natural pump that enhances blood flow to areas often affected by reduced circulation, such as the penis. To practice this 1-minute technique, sit upright in a chair with your feet planted on the ground, or lie flat on your back. Place one hand on your abdomen and the other on your chest. Inhale slowly through your nose for about 4 to 5 seconds, making sure your belly rises as your diaphragm fills with air. Hold the breath for just 1 or 2 seconds. Then exhale gently through your mouth for 6 to 7 seconds, allowing your belly to fall naturally. Repeat this cycle continuously for 1 minute. During this time, focus on relaxing the muscles of the pelvic floor and lower abdomen as this further improves blood flow to the region. The effects may be subtle at first, but many men notice a sensation of warmth or tingling in the pelvic area, which is a sign of increased circulation. Practicing this quick exercise once or twice daily can help prime the vascular system, making it easier for erections to occur naturally over time. Incorporating this 1-minute breathing routine into your day not only supports sexual health, but also improves stress management, heart function, and overall well-being. Consistency is the foundation of any meaningful health improvement, and this applies equally to breathing exercises designed to support cardiovascular and sexual health. A single session of focused breathing may temporarily increase circulation, but it is the regular repeated practice that truly conditions the body to function better over time. Just as muscles respond to strength training and the heart adapts to aerobic exercise, the vascular and nervous systems adapt to daily breathing practices by becoming more efficient in delivering oxygen and maintaining healthy blood flow. For men over 50, whose cardiovascular systems may naturally lose some elasticity and efficiency, consistency is the key to counteracting age-related decline. When practiced daily, even for just 1 to 2 minutes, deep breathing exercises strengthen the autonomic nervous system, which controls involuntary processes like heart rate, blood vessel dilation, and stress hormone regulation over time. This leads to improved vascular flexibility, allowing arteries to expand and contract more effectively. This has a direct impact on sexual health, because erectile function depends heavily on the ability of penile blood vessels to fill and retain blood. By consistently improving circulation, men give themselves the best chance at maintaining or restoring natural erectile function. Consistency also reduces stress-related damage to the body. Chronic stress triggers high levels of cortisol and adrenaline, which constrict blood vessels and limit blood flow to less essential areas like the penis. Regular breathing practice, however, trains the body to lower stress hormone production and activate the parasympathetic nervous system, the rest and digest mode that promotes relaxation and healing. This shift not only benefits heart and brain health, but also creates the optimal internal environment for sexual arousal and performance. Without consistency, the benefits fade quickly, as the body tends to revert to old stress patterns. From a practical standpoint, making breathing exercises part of a daily routine is what ensures lasting benefits, whether it's done first thing in the morning, during a midday break, or before bed. The important factor is building the habit. Some men find it helpful to link the exercise to an existing routine, like brushing their teeth or stretching, so it becomes automatic. The cumulative effect of weeks and months of practice is far greater than any single session. Ultimately, consistency transforms a simple 1-minute exercise into a long-term strategy for better health. Men who commit to this daily practice not only notice stronger erections and improve sexual confidence, but also experience greater energy, reduced anxiety, and enhanced overall cardiovascular resilience. It is this steady dedication rather than quick fixes that leads to lasting vitality. Breathing techniques on their own can provide noticeable benefits for circulation, stress reduction, and sexual health. But to achieve the best and most sustained natal results, they should be combined with other core health practices such as exercise, hydration, and regular medical checkups. Each of these factors plays a vital role in maintaining vascular health, hormone balance, and overall well-being, and together they create a powerful foundation for men over 50 who want to restore or maintain erectile function. Naturally, exercise is one of the most important complements to breathing techniques. Physical activity strengthens the cardiovascular system, improves circulation, and enhances the body's ability to deliver oxygen and nutrients to tissues, including those in the pelvic region. The aerobic exercises like walking, cycling, or swimming boost heart health, while strength training maintains muscle mass and hormone balance. Specific workouts such as pelvic floor exercises also directly support the muscles involved in erectile function when paired with mindful breathing. Exercise not only conditions the body, but also helps lower stress, making erections easier to achieve and maintain. Hydration is another essential component. The human body relies heavily on water to transport oxygen and nutrients, maintain blood volume, and keep tissues elastic. Dehydration, even mild, can thicken the blood and reduce circulation efficiency, which directly impacts erectile function. For men over 50 who may already face age-related changes in blood vessel elasticity, staying properly hydrated is crucial. Drinking enough water throughout the day, as well as incorporating natural nutrient-rich fluids like herbal teas or pomegranate juice, can optimize vascular performance. Breathing exercises enhance oxygen delivery, while hydration ensures the blood remains fluid and capable of carrying that oxygen where it's needed most. Regular medical checkups tie all of this together by providing the oversight needed to catch potential issues. Early erectile problems can sometimes signal underlying conditions such as hypertension, diabetes, or cardiovascular disease. Routine screenings allow men to track blood pressure, cholesterol, and hormone levels, ensuring that lifestyle changes are supporting, not replacing necessary medical treatments. Breathing techniques and natural health habits can be incredibly effective, but they work best when guided by medical knowledge and oversight. When these elements, breathing techniques, exercise, hydration, and medical checkups are combined, they create a comprehensive approach to men's health. Breathing provides immediate relaxation and circulation benefits. Exercise strengthens long-term cardiovascular capacity. Hydration ensures efficient blood flow, and medical care safeguards against hidden risks. Together, they empower men over 50 to take control of their health and maintain vitality well into later years.